The world marks the 2021 World Water Day. President, General Assembly of the United Nations, Volker Bozkır, has said billions of people are facing the COVID-19 pandemic without basic hand-washing facilities, a stark example of global inequality that must spur us to action. Mr. Bozkır addressed a one-day high-level meeting to promote the implementation of the water-related goals and targets of the 2030 Agenda in support of the implementation of the Decade on Water and Sustainable Development, that's 2018 to 2028. He also commented on the high-level political forum on sustainable development, adding that health providers in some of the least developed countries do not have running water. And it's important to reconcile, especially when we live in a world of such abundance and of such profound innovation. On his part, Deputy Secretary General Amina Mohammed told the meeting that by 2040, 1 in 4 of the world's children under 18, about 600 million, will be living in areas of extremely high water stress. Now let's talk to UNICEF Water, Sanitation and Hygiene, specialist Jonathan Ekhator, who joins us for more on this development. We're told that millions of Nigerian children still do not have access to potable water. What would you say is responsible for this supply deficiency?
Thank you very much for having me. Actually, what you said is very correct. According to the WASH National Outcome Routine Mapping of 2020, 30% of Nigerians do not have access to safe drinking water. And here we're talking about water that is from an improved source and free from contamination. So basically, the reason for this is the fact that a lot of the water systems in Nigeria are not functional. The same report makes us realize that 26% of the water facilities in Nigeria are not functional. And in fact, most water facilities, when constructed, break down in the first 3 to 6 months. So this is a situation that has made it very, very difficult to have enough water for many people in the country. And I'll let you know that actually about 26.5 million children are disproportionately affected in terms of water availability. In fact, they are experiencing high to extremely high water vulnerability.
Indeed, Mr. Ekhator.
So in a situation,
in the absence of this water structure, pipe-borne infrastructure that you highlighted earlier, what we have currently in the country are people are making use of boreholes now. People buy water in PET bottles and in sachet. Talk to us about how sustainable these alternatives are.
These alternatives are not sustainable, and I think that is one of the problems we have. So, like I said, in a situation where you have communities living or depending on surface water or unimproved water sources, they are not sustainable. What we really need as a country are systems that are sustainable and that provide equitable access for men, women, and children across the country. Because the implication for these unsustainable water sources or water services in the country are very grave for children. A situation where a child will have to queue for over 30 minutes or walk for 500 meters to a kilometer to get safe drinking water is not sustainable. And so when people resort to self-help by getting sachet water or doing individual borehole, we are just basically postponing the problem because this is the water crisis is actually happening already. It's a time bomb, and we hope that we are able to curtail this issue of water scarcity before it becomes a big problem for the country. So people are really suffering from inadequate water supply, and if we do not address it as a country collectively, with all stakeholders being on deck to address this issue,
well, let's hope that government is doing something. And this time bomb you're talking about doesn't explode. UNICEF Watch Specialist Jonathan Ekhator, thank you for talking to us tonight.
Thank you very much for having me.